Cassandra Lane. I'm a registered nurse in the Medical Intensive Care Unit here at St. Mary's, or now called St. Vincent. Welcome to my capstone presentation for my RN to BSN program at Vincent University. Today I'm going to talk to you about the Modified Early Warning Score, or MEWS, for clinical deterioration. So many medically deteriorating patients will have clinical signs and symptoms in the days and hours before a medical emergency takes place. In 2016, it was stated by the American Heart Association that out of 209,000 cardiac arrests, patients within the United States, only 24.8% of them survived. I believe that it is imperative to identify deteriorating patients as early as possible on all of our inpatient general medical hospital units to prevent or manage medical emergencies. Many times, hospital general medical units only check vital signs every 4 hours, and sometimes even less for being understaffed. If rounding and vital sign checks occur on patient only every 4 hours, then patient vital signs are left unmonitored for 96% of the time. 33.9% of inpatient cardiac arrests occur on general medical units with a mortality rate of 58.5%. Of those patients who suffer cardiac arrest on the general medical floor, they have a 53% higher chance of death as compared to being in the intensive care unit beforehand. Early warning scoring systems, or EWSS, can be used to help identify at-risk deteriorating patients and can help determine the need of transferring patients to a higher level of care if needed. EWSS gives general medical unit nurses the ability to recognize rising patient acuity and promote prevention of adverse patient outcomes and complications. What I really want to talk to you guys about today is the Modified Early Warning Score, or MEWS for short. So what exactly is MEWS? MEWS is a type of early warning scoring system, or EWSS like we were talking earlier, based on a principle that deterioration can be seen through subtle changes of patient assessments. MEWS is a data collection tool calculated by systolic blood pressure, heart rate, respiratory rate, temperature, and level of consciousness. MEWS can be used as a track and trigger system, suggesting increased frequency of patient observations as scores rise up to urgent assessment by a rapid response or medical emergency team. From hospital to hospital, you will see that there are different policies for rising MEWS scores. So here I've added an example of what a MEWS system would look like. Patients will be assessed for the respiratory rate, heart rate, systolic blood pressure, temperature, and level of consciousness, like I said before. Based on their assessments, the patient will receive a certain score. So for example, a respiratory rate of 9 to 14, you'll get a 0. What if my heart rate was 101 to 110? That would give me a score of 1, and then so on and so forth. Practice that has shown to be effective through research allows nurses to better advocate for their patients and provide the best possible care. Research promotes evidence-based care, and that is why I've researched multiple current literature sources to be able to see and show how MEWS can be effective in our hospital. And the first study I examined was a 1,000-bed university hospital in Amsterdam, the Netherlands. The authors used MEWS to recognize deteriorating patients and early initiation of a rapid response system within 18 randomized units. 10 of the units used a MEWS protocol, while the other 8 used MEWS only when clinically indicated. It was found that MEWS was calculated 70% of the time in the protocol group as compared to the other group only using it 2% of the time. The 10-unit group also found that documentation of MEWS 3 times daily resulted in higher detection of patient abnormalities and earlier activation of a rapid response team. In a tertiary referral hospital in Brisbane, Australia, examination took place of a 24-hour post-ICU discharge and 24-hour preceding unplanned admissions to the intensive care unit. The authors of the study were able to find that there was a 210% increase in the frequency of vital sign documentation during the first 24 hours post-discharge from the ICU, and overall increase in the vital sign set recording for unplanned ICU admissions with the implementation of MEWS. In a university-affiliated SAAN medical center in South Korea, 100 randomized patients from both ICU and general medical units with a diagnosis of severe sepsis and/or septic shock were studied using MEWS and lactate laboratory values. The study found that a higher MEWS was positively associated with a 28-day mortality rate of inpatients and can facilitate determination of what patients should be transferred to the ICU or a higher level of care. At the University of Chicago Medical Center, 30,677 patients were screened in the emergency department using a quick sepsis-related organ failure assessment, a systemic inflammatory response syndrome, or SIRS, the National Early Warning Score, or NEWS, and the MEWS. It was determined that NEWS and MEWS have better specificity and sensitivity than the SIRS and the quick sepsis organ failure assessment. MEWS was determined to be the best tool to predict the need of a patient transferred to the ICU and could calculate mortality rates more accurately than the others. The last study to be researched upon was a Mulongo National Referral Teaching Hospital in Uganda. 452 patients were observed in determination of usefulness of using MEWS as a triage tool. The hospital concluded that a MEWS of 4 or greater gave a prediction of a 7-day mortality rate of patients, and it allows healthcare personnel to identify critical illness at a much earlier rate. I would like to be able to conduct a research to determine if the MEWS system can identify the risk of patient deterioration on general medical hospital care nursing units as compared to no screening tool at all. The population of the study would include patients of general medical hospital units. The targeted group of patients would have the MEWS score as compared to another group with no scoring system at all. I want to be able to show that MEWS can identify and treat deteriorating patients and that can predict who needs to be transferred to a higher level of care. The Newman system model is a theory developed by Betty Newman that states nursing is a profession where care must be done in a holistic and system-based approach. The theory suggests that patients determine their reaction to stressors with changes of body behaviors, and that prevention of stressors and their detrimental effects on the body is vital. The MEWS could be incorporated with the theoretical framework acting as an early identification process to prevent and treat patients before medical emergencies take place. A non-experimental quantitative study could be used to measure the effectiveness of MEWS to identify and treat deteriorating patients with the possible transfer to a higher level of care. This study could be carried out for 3 months using at least 300 randomly selected patients within the general medical units of 6 southwestern Indiana regional hospitals, which can include here St. Vincent. Initial, changing, and post-discharge MEWS will be observed and calculated to determine its effectiveness. All patients would be protected under HIPAA laws, no names or personal identifying information would be published, and an informed consent would be obtained. I would make sure that patients would receive a follow-up survey to determine if any changes in the hospital affected their quality of care. MEWS can be used as a data collection tool comparing the initial, change, and post-discharge scores. Time and location of vital signs in MEWS, laboratory results, and documentation of increased level of care from the electronic health record can be collected for analysis for admitted patients initially located in the hospital general medical floors. A chi-square formula can be used to determine the relationship between MEWS and expected patient deterioration. In conclusion, it is important to know that patient deterioration can occur every day in all healthcare facilities. MEWS is a tool that can be used in order to help identify, recognize, and treat patient deterioration. The MEWS system that is currently in place at the hospital can be researched upon to show its effectiveness, whether or not the system is in need of updating. I hope that you have enjoyed my presentation, and I'd be happy to answer any questions following, and I appreciate you being here. And these, on the next 2 slides, are all the references that I had to use. So, thank you.